All right, welcome back to ABA exam review and the continuation of our BCBA exam practice series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like, subscribe, and share. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A behavior analyst is gathering information to understand the factors influencing a child's behavior at school. The analyst asks the teacher and parents questions about the circumstances surrounding the behavior and uses rating scales to collect data about potential triggers and consequences. The child is also asked about their likes and dislikes. What should the analyst do now? Let's think about what the analyst has done so far, because in order to figure out what's next, we have to think about what we've already done. We know the analyst is trying to understand the child's behavior. So they ask teacher and parents questions, they use rating scales, and they ask the child about their likes and dislikes. So far, how can we classify the assessment that's been done? Well, essentially what the analyst has done is interview teachers and parents. They've interviewed the child and they've used rating scales. So what they've done are a bunch of indirect assessments, which are helpful. But before we can start treatment planning and getting down to the more precise and detailed treatment planning options, we first need to actually observe some behavior. So what can the analyst do now that the indirect assessments are done? A, conduct a reinforcer assessment and start planning treatment. Well, we don't have treatment yet, right? Because we haven't even directly observed anything. What does the behavior look like? What do we see from our own direct observation? We can't plan for treatment without direct observation. So B, conduct a direct behavior assessment, is going to be the next best step. Actually observe the child at school. C, evaluate the collected data and start designing function-based treatments. We shouldn't design treatments based on indirect data alone. We've got to see it for ourselves. And then D, conduct a functional analysis on the behaviors that were mentioned by the teacher and parents. Before we get to the functional analyses, we need our own direct assessment so we can identify the behaviors of interest and what the next best step forward is. Once we've identified those potential behaviors, then we can move on to the functional analyses. So what's next? We, or the analyst, should conduct a direct behavior assessment. Alan is much more likely to be thirsty for water after playing outside on a hot day, opposed to sitting inside his house watching television. Alan will only ask for water if he sees a water bottle nearby. How do you explain the relationship between Alan's behavior and the environment? So let's think about Alan's behavior. What do we know so far? We know he's much more likely to be thirsty for water on a hot day, which makes sense. He's getting deprived of water. It looks like some sort of motivating operation. He's entering a state of deprivation. Then it says Alan will only ask for water if he sees a water bottle nearby. So if Alan's behavior changes in the presence of the water bottle, what can we say about the water bottle? Well, we could say it's an SD or that it has stimulus control. So how do we explain the relationship between Alan's behavior and the environment? A, the hot weather is an MO and the bottle has stimulus control. Sure, the hot weather is making Alan thirsty for water, likely depriving him of water or making the water more valuable. And then he's only asking for water if he sees the water bottle nearby, meaning the bottle has stimulus control over his behavior. A looks good. Read all of your answer choices every time. B, the hot weather and bottle both have stimulus control. Well, it says Alan only asks for water if he sees a water bottle nearby. So the hot weather is not changing the behavior necessarily. It's not evoking the behavior. So it doesn't necessarily have stimulus control. Only the bottle does. C, the hot weather has stimulus control while the bottle is an MO. It's actually reversed, right? The bottle isn't the MO, it is the SD, signaling reinforcements available. And then D, the hot weather and bottle are both motivating operations. And when he sees the water, he already wants the water, and it evokes the behavior of asking for water, making it an SD, not necessarily a motivating operation. So Alan's behavior in the environment can be described as the hot weather is AMO and the bottle has stimulus control. Lisa puts together a research design that involves 4 participants. She reaches out to each participant to ask when they would be able to start. Some of the participants are available as early as next week, but some can't start for another couple of weeks. Lisa decides she will start one participant now and then the next one in a week or so, at what point she might move the first participant to intervention. What design does this resemble? All right, so it is a experimental design question, and what kind of design are we using? Well, what do we know? We know we have 4 participants. The participants are available as early as next week, but some can't start for a couple of weeks. So what Lisa is going to do is start a participant now, wait a little while, and then start the next one. So what do we call that? What is the precise name? A, multiple probe design, or B, multiple baseline design? Well, maybe, right? But we don't know if it's going to be a probe or a baseline necessarily, but we do know it is going to be delayed. So based on the answer choices, the much more precise answer would be a delayed multiple baseline design. Remember, we have to work within the information given to us and pick the best answer. And based on the information, the best answer is C, a delayed multiple baseline design. A multi-element design would involve multiple interventions, and we're talking about participants here. So Lisa is delaying her design, and it looks like she's using some sort of delayed multiple baseline design. A case review highlights the fact that the client in question has been kicked out of multiple schools and is a possible victim of abuse from one or more stakeholders. The client is very combative around adults, will lash out if given feedback, and will sometimes engage in property destruction. How does this behavior likely come about? Now, it seems like a strange kind of question because obviously this behavior came about from the information we're given, right? The client, potential victim of abuse, he will be combative around adults, lash out if given feedback, been kicked out of multiple schools. So just from this information, it's pretty clear he's got a very difficult past with schools and adults and stakeholder figures. So how would we describe that in behavior analytic terms? Would we say his behavior came about through selection by consequences? Well, sure. His behavior has either been reinforced or punished in certain ways, which has led to more or less of certain behaviors. That's how behavior persists. What about B, the ontogenic history of the client? Could the client's learning history have something to do with the behavior they're now exhibiting of aggression and lashing out? Absolutely. Think about it. He's been kicked out of multiple schools, possible victim of abuse. That ontogenic learning history plays a big part, we would think. What about D, the phylogenetic history of the client? Now, are we talking about over a long decade, century, hundreds of years that this client has all suddenly developed these behaviors? Not necessarily. There's no genetic indicator here. There's nothing that would indicate that is a hereditary thing. We're really thinking about the environment here and the ontogenic history of the client and their learning history with stakeholders and schools. So how do we think this behavior came about? Most likely both A and B. Claire is practicing singing happy birthday all week for her dad. This morning when her dad walked in the kitchen, Claire was unable to sing happy birthday when her mom asked her to in the presence of her dad. What effect might dad be having on the singing behavior if singing happy birthday is in Claire's repertoire? So let's think about this. Claire is able to sing happy birthday, but what is the problem? Well, when her dad is around, she cannot sing happy birthday. So here's a skill that we know that Claire can do, except when dad is around. So what do we call it when a stimulus is blocking or masking a skill? Well, we might call it stimulus blocking, right? Where dad is the stimulus blocking Claire's ability to sing happy birthday. What is overshadowing? Well, overshadowing has to do with learning the skill. If a stimulus is preventing learning of a skill, that's overshadowing. So that's the key difference between that blocking and that overshadowing. What about positive punishment? It doesn't appear that dad is punishing the behavior because Claire is not even engaging in the behavior. You can't punish something that's not happening. The most likely effect that the dad is having on the singing based on the information is stimulus blocking. Thanks for watching. Be sure to subscribe on YouTube. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. We'll see you soon.